Hello, and welcome to the very first special edition, webcast edition on disease forensics. I thought today, with today being World Rabies Day is every September 28th. This was a wonderful way to do the very first special edition. So I'm sure you're probably assuming that today, since today's World Rabies Day, we are going to talk about rabies, right? So I'm not going to go too much into symptoms. My focus is going to include ways to prevent the transmission of the disease, why is it so important to us even here in the United States, what we can do to mitigate or reduce the likelihood of transmitting rabies, and so on and so forth. That's going to be my focus. So not only saying, oh, here's some textbook information, but I'm going to tell you on what you can do to try to reduce the likelihood of having rabies in your community. Okay, so as I said today, September 28th, 2018, this is World Rabies Day. Now this is something that has been going on through Rabies Alliance. Rabies, if you go to www.Rabies Alliance, that's RABIES, ALLIANC, C as in cat, .org. You can find out, of course, information about the rabies virus, what campaigns they're doing. The real focus has been that they are trying to get rid of rabies globally. Okay, that's why they had started this. So their goal is to be rabies-free by 2030. Now, that will be very hard. It's not impossible, but it will be hard. So I'm hoping that the more we talk about it, as I have said in past forums, the past installments like public health or Hollywood and public health, that we talk about ways that we can prevent disease transmission and keep our community safe. Public health is very important, but the first thing we have to acknowledge and understand is we all have a part in it. There's not a single person in a community that does not have a part in keeping their community safe and healthy. So the hope is to eliminate, according to Rabies Alliance, the hope is to eliminate the rabies virus by 2030. The World Health Organization, or WHO, or WHO, has been working with them, trying to bring this a reality. So they've set up different kind of rabies vaccination campaigns and other ways to get animals vaccinated that are at risk. They are also really into promoting this Rabies Day event. So what does that mean? Well, if you go to the website, especially if you're watching us as an educator, a professional, that you work at your animal control, that you work at your sheriff's office, that would be another good one. Any type of allied field, if you go to their website, you can actually download a campaign package. So they tell you on how to have your own World Rabies Day event so that you can find a way to promote vaccines and awareness and mitigation practices to the people within your community. So it's a really good website to help people see their part in preventing the rabies transmission, the transmission of the rabies virus. So why is this a big deal? You know, we think we don't hear much about it in the United States, and I'm going to talk about that in a little bit, but I want to bring a global awareness of this and then focus down on us individually, okay? So the rabies virus is actually in more than 150 countries, okay? So it's in a heck of a lot of places. It is 100% preventable. How? And we're going to get to that, okay? So it's one of the few diseases that we have that we can say can 100% be prevented, okay? Now, those of you that have watched my World War Z in public health, if you watched the last installment, I brought up something called, I refer to as vaccine threshold, which is the number of people that have to have a vaccine within a community to really help keep that disease out of the community, okay? So for the rabies virus, what is recommended by Rabies Alliance is that there has to be a minimum of 70% of vaccinations in dogs and livestock. Now I have to say I'm kind of surprised about that cats aren't included in that. However, you know, cats aren't kept as pets all over the world, so that could be a possibility of why we're not hearing specifically about cats. Dogs are a concern in many parts of the world, although we don't have a huge issue with dog packs here in the United States. There are many other countries where actually the number one rabies carrier are stray dogs. So with us here in the States, it's wildlife is the much bigger concern. So they recommend 70% of all livestock and canines within a community. I would add in there cats, and I'll explain to you why cats are such a concern too. So worldwide, every 9 minutes, guys, that's 9, okay, 9 minutes someone dies of rabies. So let's see, right now I've been talking for almost 6 minutes. So in about 3 minutes, 4 minutes, about 4 minutes, that means one person has already died of rabies, okay? That's pretty big, every 9 minutes. So it is definitely an issue. It's a public health issue that we all need to recognize our part in keeping our community safe. This is definitely on One Health concept promotion. So like I've mentioned to you before, One Health means you're including animal health professionals, human health professionals, and environmental professionals. So that's a pretty huge swath of people that look at ways in keeping us all safe and free from disease. So we have One Health. We need to have county government involved in this. So that means like animal control officers, health department officials, legislators, because one of the things they do, they provide laws and tell us that dogs have to be rabies vaccinated. And we need educators and every really community goer. You know, educators like our teachers help to tell children, for instance, do not walk up to strange dogs, right? So they have a key in it. As community members, if you're a pet owner, you're part of it. You know, whether it's vaccinating your pets or whether it's telling kids, hey, don't walk up to my dog, okay? So we all have a stake in keeping our communities rabies free. Everybody, every person does. So to touch the symptoms a little bit, because this does affect what I'm going to talk about later. I'm not going to go into great detail about the symptoms because the thing about rabies is the symptoms are pretty vague until it's really too late to do something. So the symptoms that are rabies specific, by the time they hit, there's usually very little that can be done. Okay, so after an animal bites, the concern is where it bites. So the virus is in the salivary glands, which means the saliva is where the virus is transmitted. So in other words, it's not common, it's not something that happens frequently, but a rabid animal can transmit the rabies virus with a scratch. Because once they break that skin barrier, and if there's saliva that enters that site, okay, so the saliva that enters that site that has the virus can be transmitted. It doesn't require a bite, but a bite is the most common way it's transmitted, okay? So the animal that's rabid bites a person, and I've mentioned this in a few of the public health segments that I've done through World War Z and public health, that it really depends on where the bite is and location to the brain to how quickly symptoms develop. The closer it is to the brain, typically the faster the symptoms develop. It can take days or weeks, and the longest case I ever read about was 2 years, which is very rare. I have to say it's incredibly rare, but again, it can happen. That's the problem with rabies, is that how often, if you are bitten by a dog, are you going to remember the exact date of when that was 2 years ago? Probably not the exact date, right? So it's really important that we take the precautions to prevent it to begin with, okay? So symptoms can start as pain at the site, malaise, which just means I just don't feel well. There can be swelling. There can be more deferred pain, which is a pain that spreads. The closer that it gets to the end, for lack of a better way of saying it, you end up developing more neurological or symptoms that come from the brain, the nervous system. So it can be that you experience irritability. You know, irritability can be a sign of something neurological. It can be irritability. It can be that you experience incoordination. It can be that as the people progress, they slip into a coma. Once symptoms start to show, okay, once you start to have symptoms, there's not too much that can be done to help the person, and it's more making them comfortable. So we need to make sure that we're doing what we can do to prevent it from happening to begin with, okay? So it is a disease that's transmitted by mammals. Now, theoretically, mammals, even marine mammals, can get it. Now, the odds of a marine mammal being bitten by a rabid land-dwelling animal is pretty slim. That's in a lab setting, okay? But we know that all mammals are susceptible to it. It varies depending on their eating habits, where they nest at, their body temperature, and some other genetic issues. Okay, so it varies according to the species, but all mammals are susceptible to the rabies virus. Now, we do know that the most common rabies carriers are bat, fox, coyote, skunk, and raccoon. Now, of course, dogs and cats are in there too, but I'm focusing more on the wildlife aspect. So those 5 wildlife animals are more commonly able to carry in the United States, are most commonly able, the most commonly ones diagnosed with the rabies virus. Okay, so knowing that, there's certain steps we would take, and I'm going to cover those in a few minutes here, there's certain steps we can take that can minimize the risk of transmission, because we know what common carriers or which species can commonly carry, or most common can carry, the rabies virus. So the one thing that I want to hit on here, it can kind of give you an idea of a case of someone that's developed rabies. I thought I would read you this. So this is from the MMR. Okay, so the MMR is something that's published regularly by the CDC, so the Centers for Disease Control and Prevention. And it's something that they show, like they'll have their field staff that talk about some emerging diseases or some special concerns within a community. Their scientists might submit something. So it's a way to disseminate or provide information from the CDC down to communities. Okay, so doctors, practitioners, lay people even. Like if there's something you want to know about disease, go to the CDC, look up the MMWR, and you can get some really good information. Okay, so they can be case studies and so on. So this is Epidemiologic Notes and Reports, Human Rabies, Michigan. Okay, so this is about an actual case that was in Michigan. So the first case of human rabies acquired in the United States since May of 1981 occurred recently in Michigan. This is from the 80s. Okay, this is from the early 80s. The patient, a 5-year-old female, possibly bitten by a bat in late August 1982, died on March 9th, 1983, 32 days after onset of symptoms. So what this is saying is that they believe she was bitten by a bat in August of 82, but she didn't die till March of the following year. So let's see, what is that? So it's September, October, November, December, January, February, March, right? So 7 months. It took 7 months from the time she was bitten to when the girl died, okay? So the child developed right arm pain and fever after a fall. On February 7th, an acute sprain of the right arm was diagnosed. By February 11th, she had malaise, which is, like I told you, just means I don't feel well, very general. Anorexia, not eating, sore throat, left heel pain, and right arm weakness. Pretty nondescript, right? Malaise, anorexia, sore throat, left heel pain, and right arm weakness. Nothing that was at all that would have been alarming to hear a kid. She appeared ill, but was alert and cooperative after hospitalization, and had point tenderness at her right wrist, elbow, shoulder, and left heel. So point tenderness means those parts hurt. If I was to push them, it would hurt. So again, that was her right wrist, her elbow, shoulder, and left heel. But again, remember, she went in for treatment after a fall. So nothing really alarming, right? The white blood cell count, or WBC, that would be like a component of immune response. So something's there, was 12,800. And a bone scan of the right wrist showed evidence of osteomyelitis, so that's swelling. Over the next 48 hours, she became irritable with a temperature to 39.3 Celsius or 103.9 Fahrenheit, which is how we'd read it, 103.9, progressive right arm weakness, urinary incontinence, and difficulty swallowing saliva and water. So when you hear weakness, urinary incontinence, difficulty swallowing, that could all be signs of something neurological. That can be something definitely neurological. On February 13th, Okay, so this started on February 7th after fall. On February 13th, she became lethargic, so she's exhausted to the point she doesn't want to move, and hypertensive, which is elevated blood pressure, and was transferred to another hospital. Rabies was considered, but no clear history of animal exposure could be obtained. Cerebral spinal fluid, okay, or CSF, revealed 10 WBC, or that white blood cell count, and negative bacterial culture. So they couldn't find any bacteria. There wasn't any bacteria in what they could obtain from that stick. CAT and brain scans were normal, and EEG was diffusely abnormal without focal findings. The next day, she became obtunded and developed progressive respiratory distress requiring mechanical ventilation. So that's a lot of jargon in that. So it meant she was unable to breathe on her own without assistance. So as a result, she had to be put on a ventilator. The presumptive diagnosis was post-infection encephalopathy, and treatment with high-dose steroids was initiated. By February 17th, she was comatose. So she went in for a fall because of a fall on February 7th. By the 17th, she was in a coma. On February 23rd, the family remembered a possible bat bite in late August 1982. So she's already been getting treatment. She's been now in a coma for a week, okay, or 6 days. And then the family is remembering a possible bat that had bitten her back in August, so 6 months prior, in late 1982. Now I'm not going to read, this is all information about the lab work, how they were able to confirm it, because it basically, everything in that paragraph summarizes saying that rabies was confirmed. Okay, the rabies virus was found in her system. So here's the editorial note. This is the first case of human rabies reported in Michigan since 1948. So we went from, this is in 1983, from 1948 to 1983 with no confirmed, I want you to hear that word, confirmed, no confirmed cases of rabies, okay? Despite its rarity, rabies should be considered in any undiagnosed neurologic case. No source of exposure has been identified in approximately 40% of human cases in the United States in the past 10 years. I want to read that statement one more time. No source of exposure has been identified in approximately 40% of human cases in the United States in the past 10 years. What does that mean? That means that they never identified a bite. And I'm going to talk to you in a moment, in a couple minutes here, of why that may be. Okay, very probable reason why that may be. But so they end up diagnosing it, could be after someone's deceased, but they're diagnosing it at some point rabies, but they aren't doing it because of a bite. Okay? Without treatment, rabies antibody titers typically rise to levels of 1 in 10,000 to 1 in 60,000. Don't worry about that right now. Concurrent steroid therapy has been shown to prevent antibody formation in rabies vaccine recipients, and like interferon, appears to have little effect on clinical illness. So why is that a big deal? So if we're saying that 40% of cases are going that there's not an obvious sign, like a bite or something obvious, that we go, oh, the person was bitten, we better look for rabies. Okay? This patient, this little girl, they believed it was post-infectious encephalopathy, so they gave her the steroids probably to treat the inflammation. That probably was the point of why they gave her a high-dose steroid, right? The problem is when the mother realized that she was bitten by a bat, and then they go to give her the injection to help her, it's not going to work because they'd already been giving her a high-dose steroid. That's why that's significant. So if we're not diagnosing accurately a patient that could possibly have steroids, or have rabies virus, and we're giving them steroids, then we're undermining the treatment. That's why that entire paragraph is so significant. So we need to understand our risks so that not only that if something does happen, it's at the top of our memory, that we need to do something about it and let our practitioners know, our doctors, emergency room doctors, public health officials, but also ways to prevent it to begin with. So hopefully we don't have to get to that point. Okay? So as I've done before in my other videos, I will post the link to this along with this video so that you're able to look it up for yourself, because I definitely want you guys to see these things for yourself. I know with me, sometimes I do better when I'm reading it even than hearing it. Okay, so I definitely want to post that for you. So we've got some information. I told you why it's so important, that it's a worldwide disease, rabies, that affects more than 150 countries. I've pointed out to you guys of the fact of the symptoms can start off rather vague, so it's hard to pinpoint. That it's sometimes misdiagnosed. And I also pointed out that there's actually campaigns that the World Health Organization, along with the Rabies Alliance, is hoping to make this disease no more by 2030, right? And I want to get to the point now of what we can do to accomplish that goal, okay? So there are some books that I would like to introduce to you guys, and one of them, it could be for lay persons or professionals. The other two, I mean, of course, lay people, you're more than welcome to read it yourself and make it sound like I'm discouraging you, but the other two are mainly geared towards professionals, okay? So the first book, and I'm actually still reading this one myself, is called Rabies, okay? So Rabies, which is by Bill Wasik and Monica Murphy. It's a very interesting book. So it's called Rabies, A Cultural History of the World's Most Diabolical Virus. This really goes back to the first time that we have ever recorded it. So we're talking Romans, we're talking Egyptians, of how, what was it really like? How did they think they could treat it? It talks about how all the folklore that much like if you've heard about like the children's song Ring Around the Rosie, what it actually means. Well, now we're talking about something that was included in nursery rhymes, just like that, about the rabies virus. About a lot of the lore that surrounds rabies virus. It's very interesting because a lot of our medical practices and what we do today was based on something cultural, right? Was based on something that was a religious significance or something similar. So this goes back to way, way, way at the beginning of what did we do about when we suspected what would be later called the rabies virus. But she also, or should say they, also make reference to the importance of why and what happens, one of the big contributing factors to rabies or any disease transmission. And I just want to read you these two sentences out of here. So with most zoonotic leaps in disease, so remember zoonotic are diseases that are transmitted from animals to people. So with most zoonotic leaps in disease, animal contact is the spark, but urbanization is the bone-dry tinder. A newly evolved pathogen is any organism that causes disease, so a newly evolved pathogen can't spread from person to person, after all, unless people run across one another in the first place. So the more densely we live, there's typically higher disease. So, it brings up how those diseases are transmitted. But the focus is the rabies virus. It's very, very interesting, and so far I really like it. It's very, very well written. I'm very pleased. So this would be a book for lay persons or professionals that really want to learn about what the rabies virus, how it used to be treated, okay, or how it used to be viewed. So this one is from Iowa State University. I'll open it up like this first. So, zoonosis, protecting people and their pets. Now, this one, if you go to Iowa State, the Center for Food Security and Public Health, you take the course. There's a self-paced course, and it's built for human health professionals or veterinary professionals. Okay, it's either one of them. Because remember, we're talking about zoonotic diseases that can be transmitted from animals to people. So definitely both of those professions have a stake in learning about them. Okay, about zoonotic diseases. So you take this self-paced course, and I think the cost is around $150, and you get this book along with it. They're still offering it. I had taken this, I think, around 5 years ago. They still offer the course. You can still go there. I believe they've updated the book a couple of times. I love this. And the big thing is, they have, of course, it's set with incubation times. It's for professionals. So incubation time, studies, a lot of great facts, but one of the best parts about it is the back. Okay, so if you can see this is a handout that you could give to pet owners about the rabies virus. So I have something I can put on the copy machine. I don't have to make up my own. I could simply shoot off a copy, and I have something to give the pet owner to leave with. Especially when people go to doctor's appointments or to veterinary appointments, there's a lot of information that's being provided. So at least this is something that I know I could send a pet owner home with and allow them to process on their own, allow it to reinforce what I'm telling them in the clinic. So that's one of the best parts about this. The course was fantastic too, mind you, but I have something I can actually provide my pet owners, okay, as a veterinary technician. So another book, and this is geared, and I've brought this book up before. If you've caught the World War Z in public health, then you have seen me discuss this book. So this is Human Animal Medicine, okay, and this is by Peter Rabinowitz and Lisa Conti. Wonderful book because it breaks it down by disease. It provides information to the veterinary professional, human health professional, and health department professional. So it breaks it down of what you would tell your client, your patient, in all those scenarios. Wonderfully written, great diagrams, great pictures in there that help, so you can help see with some diseases, what it may look like if you've never seen it before, so you can identify it. I just think it's a wonderful reference book that I believe should be in every veterinary clinic, every health department, every doctor's office, because how many people have pets, right? So it's something a doctor's office would definitely benefit from as well. Well, under the rabies virus, they have information here that includes by region. Now this is a little bit older. This is from 1998, the diagram that they use, and you could find more updated. The book is from, I think, 2010. You could find updated information on this online, but I just want to make a point here. So if you can see this is travel information for rabies virus. Now this is something that would be very good for human health professionals to have. People that are traveling will commonly go to their doctor, or should be, and asking, okay doctor, which vaccines do I need? And hopefully what the human health professional is saying, well, here's some basic ones that you have to have, whether it's yellow fever, whether it's making sure you have medication to treat diarrhea if you develop that overseas, or, watch your drinking water, whatever. Hopefully they're providing that basic information. But hopefully they're asking them what they plan on doing. A lot of people today are taking these eco vacations or other similar types of vacations where you could be working while you're overseas, right? So you could be volunteering at a zoo. You could be volunteering at a farm. So in other words, you could potentially be exposed to animals that could be carrying the rabies virus. So hopefully doctors, if you're watching, nurses, nurse practitioners, physician's assistant, anybody that is in contact with patients, especially those that are looking for direction on what to do because they're traveling overseas, hopefully you're asking them what will they be doing. Because then you should be aware what the rabies rates are for those countries. As I mentioned earlier in this taping, some of the places, wildlife are not the #1 contributor to the rabies virus. In some areas, it's stray dogs. Well, if the person's going overseas to work at a spay-neuter clinic, then they absolutely should have the rabies vaccine before traveling. And the rabies vaccine takes some weeks to get that going. So, not to mention to find somewhere that has it available. So that is something that doctors and your allied health professionals should be discussing with your patient so that they know they need to get the rabies vaccine before they leave. Okay? So that helps provide some travel information in it too. So that's another wonderful resource to help you provide information to your patients when they're requesting travel information. So I had mentioned before that I was going to start using this technique or this tool of our public health coat of arms, okay, which is this. This is public health here. And if you guys remember when I used it for the World War Z in public health, I put the cards on here of 4 items for professionals and lay people from that segment. Okay, so whatever I was talking about, the 4 things that I could tell professionals and lay people about public health that would be beneficial from what we discussed. Now, although I'm not taping it to this in front of you like I did in a segment, I am going to be putting on as I talk about them so that we can discuss our public health coat of arms. Okay, so the first one we're going to talk about here is our vaccines. Okay, so vaccines are a really important part of our public health coat of arms when it comes to, we're talking about, again, the rabies virus, right? Okay, so I'm going to add the vaccines on here. So vaccines are an important part of our coat of arms, or public health coat of arms. So what does that mean? Well, probably a couple of you are going, well, that's an obvious one. Rabies virus, my dog needs to be vaccinated for rabies. Absolutely. And I'm definitely going to start off with that. So with the rabies virus, in many municipalities, many areas in the United States require rabies vaccination for dogs over a certain age. That's pretty typical. Now, there are still some areas who don't, but for the most part, it is required. Unfortunately, one of the animals that's missed frequently are cats, and even indoor cats are susceptible to the rabies virus. Now, the part that always concerns me as a veterinary professional, remember I'm a licensed veterinary technologist, so I'm speaking now as a veterinary professional, is that we really don't reinforce vaccination of cats. And part of the concern is this: how many of you out there allow your cats to sleep in your bed or your children's bed? Okay. Now, what if you allow your cat outdoors? Now, I can tell you, I have 5 cats, and all of my cats are kept inside, and that still does not completely eliminate the risk, and I'm going to tell you why in a moment. But if you allow your cat outdoors, and your cat is not vaccinated for rabies, and then it's sleeping in your bed or your children's bed, you're taking one heck of a risk. Cats have a very strong prey drive, so if they catch an injured bat or some other injured animal that turns out to have rabies, or is bitten by an animal that's rabid, such as a raccoon, such as a fox, such as a coyote, it's bitten by them, and the virus is transmitted in that manner, that's a pretty dangerous situation. And then you're inviting it right into your beds or your children's bed. So cats should be vaccinated for rabies, even though the law doesn't require it. It absolutely should be part of keeping your community, and more importantly, your household safe. Okay. If you work at a farm, especially with livestock, if you work at a zoo, animal training facility, grooming facility, obviously veterinary hospital, a university that does laboratory testing, which most of them require it, but anywhere where you're in contact with animals, a petting zoo, you absolutely, I'm not talking about your pets, you should be rabies vaccinated. I have been through that. I've been through the vaccine. It's a series of 3 to 4, depending on how your body reacts and how quickly you start making antibodies. And then depending on the professional you talk to, your titer, okay, so your titer would be whether or not your body is still responding and producing the antibodies for rabies virus. That's checked every 1 to 3 years, depending on the professional. Now, I had mine, back in 2004 was my first one. I've only had to reboost once. Okay, so it varies from person to person, but I have my titer tested about every other year. Okay, so make sure that I'm staying where I need to be so that I'm not at risk for developing rabies virus in case I'm bitten by a rabies positive animal. So if you're in those fields, guys, you should be rabies vaccinated, and you definitely should be talking to your practitioners, your health department, your hospital about getting your hands on the rabies vaccine. Doctors out there, okay, you should be asking your patients what they do for a living, because this could open up a whole can of worms to any recommendations you could be providing them on any additional vaccines, such as the rabies vaccine. Obviously, I'm focusing on that because that's what we're talking about with World Rabies Day. But asking them their profession can help you determine of what your recommendation should be. I have to say that I've never been, unfortunately, the doctors I've seen over the years, I've never been recommended for the rabies vaccine. And I've always been kind of surprised about that. It's never come up. It's never even a discussion that we've had. Now, I've known, so I just went ahead and got it. I know that's what I need and had it administered. But you definitely should be having that conversation with your patients so that they're aware of what they need to do to keep themselves safe. Okay. If we're really truly doing a One Health concept, then hopefully doctors, if you find out there's pets in your household, hopefully you're telling them that they should be taking their pet to the vet. You know, hopefully that to me is a positive One Health step, that we should be encouraging people to take their pets to the vet, such as for the rabies vaccine and health checks, to make sure that they're not going to transmit something to their owners that could make them sick. Okay, so very important vaccine, and keep in mind that threshold. Do you guys remember? Huh? What was that threshold? What percentage? What percentage of a community has to have the rabies vaccine or is recommended to keep them safe? 70%. 70%. That's 7 out of every 10 dogs, right? 7 out of every 10 wildlife, or livestock facilities, right? Very important that we provide the proper vaccines. And I'm throwing in there about cats, that we should definitely have our cats vaccinated too. And I'm going to get to in a moment of why that is so very important. So, okay, so we added to our coat of arms about vaccines, right? Okay. Well, here's another part, and here's where the whole community comes into play of why it is so important that we all take part in keeping our community safe. So what's the next one? Teaching our children. So here's our public health coat of arms. We talked about vaccines here, and now we're going to be talking about teaching our children. So before I go into this, I want to read to you this article that I found very alarming. That this is one of the reasons why I'm saying how important it is to teach our kids. Okay. Child picks up live rabid bat, brings it into elementary school. So this was a situation where a child was walking to school, found a living, this is not dead guys, a living bat that turned out it was rabid, brought it to school, and now all the children that child came in contact were exposed, and the faculty. I'm going to read that title to you one more time. Child picks up live rabid bat, brings it into elementary school. We need to be teaching our children that you do not approach and pick up anything, any animal that we're not familiar with. If it was a dog that we went up to pet, we should be asking the owner, can I pet your dog? These are parts that, of course, the parents should be teaching us, but we as educators should be also teaching in our community. As a pet owner, it's my responsibility to make sure that I'm reinforcing that if I have my dog out, that a child, I should stop that child and say, you should be asking me if it's okay to pet my dog. We should be reinforcing that, because what we don't want to do is situations like that, where there is not an adult around, where the child makes up their mind that probably that kid thought they were helping the sick bat, and they're going to bring it in and then possibly infecting everybody with rabies. So we should be reinforcing that with our kids. Now, any wild animal that can easily be caught, whether it's by a child or an adult, it should be rather alarming. It should be very alarming with any child or with any wild animal that's easily caught, that it may be sick. And if it's a mammal, then we should have a very serious concern. Unless it's an obvious accident, obvious injury, we should be very, very concerned about rabies transmission. And let me take a step back here. Even if it is an obvious injury, doesn't mean that animal is not sick with something else. So we need to be thinking about those things, that we're not handling wildlife, and that we certainly are teaching our children to follow those same thought processes as well. Okay? So what's our next one? So how about reducing wildlife encounters? So reducing wildlife encounters. Now I have to say, now this is part of the reason why I did this outside. If you can see behind me, it looks rather country, right? Well, this is pretty much how my area looks. I live in a rural area of northern Michigan. Okay, so there's reduced wildlife encounters. I live in a rural area in northern Michigan, and it's rather hard sometimes to kind of keep animals away that you don't want around, because things, especially with opportunistic feeders like raccoons, it's easy to bring them in. Well, everyone should be thinking about this. Even if you're in the burbs, you should be aware of what you're doing. It could be encouraging animals like raccoons or fox or coyote to come around your home. We should be definitely discouraging that from happening. If you have outdoor animals like cats and dogs, absolutely make sure they are rabies vaccinated. But if you can avoid feeding them outdoors, you should. You know, when I was a kid, and I'm talking about a kid, okay, so less than 10, you know, I'd hear the adults say, oh, if you see a raccoon out during the day, it's probably sick, it could be rabid. That's not the case anymore today. We cannot make that determination with raccoons, because raccoons and other what are referred to as opportunistic feeders come out now during the day if they know there's going to be food available. So if I'm feeding my cat every day at 3, they could be out watching me feed my cat around every day at 3. Okay, if I'm putting my trash at the curb every morning at 10, and they can access it, then there may be a raccoon around waiting for me to put out that buffet. Okay, so we need to keep those kinds of things in mind, that we're trying to reduce those encounters. So our trash should be secure, or if we can avoid feeding our pets outside, we should, so that we're not encouraging those animals to come in contact with our pets or up to our homes, and possibly, you know, increasing the likelihood of transmitting rabies virus. Bats can get into holes as small as 1/8. Okay, 1/8 of an inch. That's small. So you should be, at least seasonally, looking around at your home. What are ways that you can reduce those chances of them getting in? Do you have nesting sites maybe that would be, or areas that could be used as nesting sites? For an example, I see porches that people don't put up lattice or anything around the bottom. Skunks love that. They commonly nest under porches. Skunks are a big and very well-known rabies carrier, so we need to do what we can so that our wildlife cannot get in those areas and nest. Okay, so look around your home. No food sources, nesting sites. If those are gone, you're going to discourage and greatly reduce your encounter with wildlife. Okay, greatly reduce the encounter with wildlife. Why else is this important? I want to give you a demonstration here. So, bat bites are a serious concern, very serious concern. It used to be that if you had a bat in your home, the health department would say, and this is many years ago, the health department would say, don't touch it, but use a net or something similar and carefully put it outside and let it go. Many health departments are not telling you to do that anymore. Why? You want to guess why? Why? Okay. They're not saying to do that because the concern is that it's not uncommon for bats to have the rabies virus, and their bite is so small that they could easily transmit the virus and you have no idea that you've been bitten. Okay, this is a special concern to vulnerable persons. So if you have elderly in your home, debilitated individuals, disabled, so bed-bound people, young children, okay, so these are people that can't react like we would typically to being bitten by something. But it's some health departments, it's not even just the vulnerable, it's period. If you find a bat in your home, contact your health department. I'm going to say it again. If you find a bat in your home, contact your health department. Do not handle it, because they may be recommending for you to send that bat in, that they would collect the bat and send it in for rabies testing. Okay? And I'm going to show you how small their bite is. So many bat species we have are very small. In the United States, many of our bat species are very small, and they produce very small bites. Okay? So here I have, this is a 3 ml or 3 cc syringe. This is a pretty typical syringe we see with vaccines, with human and veterinary medicine. It's a typical average size syringe. The needle is a 22 gauge needle. Okay, it's very small. It's a 22 gauge syringe, which is again typical in human medicine. 22, 21, 21's bigger. So 22, 21 is a typical size for a syringe. So next time you have blood taken, take a look at that needle size. This, folks, can be the size of of the bite mark a bat may leave behind. This is how small, folks. This is why it's such a big deal. Okay? So I'm going to dip this in some paint. I'm going to put it in the styrofoam because I want you guys to see. And I have a nickel that's taped next to it so you can see how small it is. Okay, so I'm going to dip this in the paint. Okay, I'm going to make sure I got it covered here. Okay, so I got it dipped in the paint here. I want you to see how small. So I've got a nickel taped here. Okay, I'm going to do a quick little jab. Can you see that little black dot? It's about the size of Washington's nose on this nickel. That can be the size of a bat bite. That's why we need to discourage bats from being able to get into our homes. Okay, this is why we need to have cats, even indoor cats, vaccinated for rabies. If a bat gets in your home, and it's common where there's roosting sites, it's common when there's roosting sites and temperature fluctuations, like it's natural in Michigan, for bats to get into your home. A cat getting hold of a rabid bat is not uncommon. A bat getting into your home that you don't know is there and bites you with a bite this small is a problem. Okay, folks? So we need to do what we can to discourage bats from getting in our home, discourage all wildlife encounters so that we don't expose ourselves, our children, our pets to the rabies virus. Okay, and last but certainly not least, what I'm going to add to my coat of arms here. Seek advice. When in doubt, reach out. Okay, so when in doubt, seek advice. When in doubt, reach out. Whether you're a health professional or lay person, if you're unsure about something, we've got plenty of resources, whether it's the Centers for Disease Control, whether it's your local health department. Don't try to go this alone, because the potential for diseases like rabies that are fatal, there's no going back. There's no trying it a different way. So we want to make sure we're getting it right the first time. We want to make sure that we're using the vaccines we're supposed to, that we're doing things to mitigate or reduce the risks. We want to do it right the first time so that we don't expose ourselves to disease. Okay? So when you talk about, like, with the statistics that I got from the state of Michigan that tell me that there were 69 animals that were rabies positive, confirmed. I want to make that very clear. Confirmed to be rabies positive.